Hello and welcome to today's episode of the program Health and Wellbeing, and I am your host, Lois Apasambo. Did you know that tuberculosis is one of the world's deadliest infectious diseases? It is a silent threat that often goes unnoticed until it's too late. Nigeria is ranked 6th among countries contributing to the global burden of tuberculosis, and an estimated 15 Nigerians are said to die each hour due to tuberculosis, which is equivalent to about 347 deaths daily and 10,417 monthly. But fear not, today we're taking a closer look at how we can protect ourselves and our loved ones from tuberculosis. Joining me on the program today is Dr. Michael Ali from the National Tuberculosis, Leprosy, Borrelli Ulcer Control Program at the Federal Ministry of Health to give us a better insight on tuberculosis. You're welcome to the program, Dr. Ali.
Thank you for having me.
And it's nice having you on the program. So let's start. Nigeria has a high burden of tuberculosis. High burden of tuberculosis cases, high burden of tuberculosis deaths.
Indeed.
First, let's start. What's tuberculosis?
All right. Tuberculosis is an infectious and a highly contagious disease that affects primarily the lungs and goes ahead to, in a diseased patient, affect the general oxygenation of the body and when untreated result in death of such a patient.
Okay, so what are the main causes of tuberculosis?
So, tuberculosis has drivers, but for the pathogen, the Mycobacterium tuberculosis complex is what's been identified as the causative organism of tuberculosis. And if I were to take you down memory lane, he was actually about 400 years ago, in the years 18th, this is 19th century, that Robert Koch discovered the organism. And before then, a lot of people suffered from tuberculosis, and humanity didn't even know what the cause was. But after the discovery, and after we isolated the Mycobacterium tuberculosis complex, now we were able to come up with treatment regimens that's been able to cure it. And ever since then, we have been, mankind making effort to actually control the epidemic and then eliminate it, because it's actually one of the diseases that we hope to actually get to eliminate.
Talking about elimination, how far are we going in eliminating? I know we keep putting targets and targets and targets. How far are we going as a country, Nigeria?
As a country, at the moment, I would say we are doing well to control. It will take some effort, a lot more from everyone to begin to get to the point where we talk about elimination. So at this point, we have a high burden. Like you said in your intro, we contribute 6th in the world, actually, to the high burden of global TB. And that puts us at about estimated 400 to 500,000 TB cases every year. So if you put the other countries side by side with Nigeria, Pakistan, Philippines, India, China, the Russian Federation, you'd see how much the estimated global burden would be. About 10 million persons get ill with TB yearly, globally here now. But as a country, we are estimating about 500,000 people to have TB each year. And of this number, how many of them are we really getting to notify? Meaning, how many of them come forward to get tested and then get diagnosed, and then we put them on treatment? You find that we are doing somewhere in the borders of the region around 50%. So about above 250,000 were detected and notified in the last year, 2022, in Nigeria, So you see that we still have about half of the burden to go, because a lot of them, about half of them who estimatedly had TB in 2022, didn't come forward. We didn't find them. And that means that if we are not finding these cases yet, So from the definition of TB being a very contagious and infectious disease, it means these 250 or more persons would have infected other persons before we even get to reach them. And by the way, we know how many persons get infected by one active pulmonary TB case in a year. It's between 50 and 20 people. In 1 year, one active pulmonary TB case, meaning someone who is coughing with active TB, will get to infect about 15 to 20 other persons. Good. So now you could do the maths. If you're finding only 50% of them, now the other 50% is evading.
Infecting more than 50%.
And they're infecting about 15, 20 other persons before you find them. So you keep chasing, and then, you keep trying to control it. So it will get to some point before we actually begin to talk about elimination, until we're able to say, okay, we have all of them, in our grasp. Before now, we'll say, okay, how many are left, and are they less than a certain proportion of the population, less than 2%, less than 5%, then we can get to that level of the debate. But right now, that's why we are a control program.
So it begins to look like we're in a rat race. Now, talking about people coming out, and you spoke about coughing, what are the symptoms? And are there asymptomatic cases and symptomatic cases?
Very correct, very good question. Because yes, oftentimes we get to talk about the symptomatic cases, but the truth is there might be cases where you may not have symptoms at all. All right, but we'll get to define those in the context. So first, there are important or cardinal symptoms you should expect to see in someone who has tuberculosis. Now, they include systemic, meaning those ones that will affect almost all parts of the body, all right? And they are the easier to tell, which include fever, all right? They include weight loss, all right? And then it includes drenching night sweats, okay? And then when it is pulmonary TB, meaning infecting the lungs, then the person is likely to be coughing. Almost all the time they'll be coughing if the TB, the infection is in the lungs. But this cough, we have to distinguish it from other causes of cough, like cold, for instance. Coryza might give you cough as well. COVID also could give you cough, is it not?
Yes.
So you'll be able to distinguish. How do we do that? So we try to find a duration to say if the person has coughed up to 2 weeks or more, all right, then the person is suspected to be having tuberculosis. So we say they are presumptive TB. All right, and then they go on to diagnose, meaning you take the sputum, all right, after the person coughs, and then you send it for molecular testing in our designated laboratories across the country, and you're able to actually, for sure, ascertain by means of diagnosis that this is tuberculosis case, and you place them on treatment, and then they are good.
Okay, so let's talk about the asymptomatic cases.
All right. So for asymptomatic cases, I will discuss those two cases or scenario that might give you asymptomatic, as it were. So the first will be those who are having what we refer to as latent TB infection. So there are a group of persons, and the truth is a lot of persons, likely in our setting and in our country, would be exposed to the organism once in a while. Someone is coughing with TB, and you get to inhale the droplet nuclei. It goes and lodges in your lungs. So a certain percentage of people would have good enough immunity to contain that pathogen, the organism, all right? And then it would be silent, and that's what we refer to as latent TB infection, because it stays dormant, all right? Because immunity is good enough in such individuals. So, but like the word goes, dormant TB infection, latent TB infection, it's likely again to get reactivated in the future if such an individual's immunity were to weaken for any reason, given uncontrolled diabetes, long steroid use, all form of immune suppressing conditions like HIV as well. All right. So, so for such persons, and it's about 30% of the population actually, you have to have them go get tested to ascertain that they have the latent TB infection, and then they can actually get treated. So for this category of individuals, they won't cough, they won't have any of these symptoms that I mentioned earlier, because they're apparently well. It's just that the organism is sitting somewhere, just lodged in the lungs and waiting for the D-Day when the immunity crumbles and then it will rear its head up. All right, so that's one scenario. The other scenario will be a group of persons who have the infection but is not necessarily sitting in the lungs. So it might be sitting elsewhere, and then it may not give you the systemic symptoms that you expect to see, the fevers and, well, may or may not be there.
Yes.
Okay? The weight loss, and it won't be classical, all right? But depending on the site or the region of the body where the organism or the infection has taken root, so the person will begin to manifest such local symptoms. And the number one I like to mention here will be TB of the spine. Yeah, so TB, and for avoidance of doubt, TB can infect virtually any part of the body, almost any tissue of the body. So people with TB of the spine may not necessarily cough, all right? And so you would not begin to easily suspect TB in them, but they would have and manifest other symptoms that might be suggestive if you are able to, with high index of suspicion, think that far. And then it will include pain around that focus of infection. So pain around that part of the back, and then maybe, in some cases, swelling. But then in children, you would have what we refer to as gibbous, meaning the curvature of the spine will be lost, okay? So there will be a point at which you find incurving or so, all right? And then there might be loss of functions, for instance, meaning, and that's usually where it has really got complicated and, you know, it's not been attended to. The person may lose the ability to walk, might be on a wheelchair, depending on the level of the spine where this infection is lodged. So that's one good case. So you might be thinking, oh, this person is not coughing, TB is not likely, but it just might be TB. But you just need someone who has the, you know, requisite skills to be able to assess such an individual and come up with a diagnosis. Other parts of the body, and it would shock you, will include even the meninges that is high up in the brain.
Yes.
Such that you have TB meningitis, just like you have meningitis, you know, good. But then TB can infect the brain and cause meningitis, and such a person might just be comatose, if you like, depending on how worse the individual really is. The person might be unconscious, that's what I tried to say. And then giving you those classical signs of meningitis, not talking, unconscious, and all that. But then you might start treating for meningitis using everyday antibiotics, not realizing this is actually caused by TB. So you have someone who's really good at the job to detect, all right? Other parts of the body include the kidneys. Someone might just be peeing blood, and you might start thinking schistosoma or something. And then you just find that it's actually TB of the kidneys. So yeah, people would have swollen abdomen for some time. You wouldn't know it's just TB there, okay, somewhere in the abdomen. So TB can infect any part of the body, but 80% of the cases it affects the lungs. Yes, 20% is outside the lungs, so we refer to that as extrapulmonary tuberculosis. And it takes high index of suspicion to be able to tell when it is outside the lungs.
Tuberculosis. It's very important that you let people know about this, you know, because even for me, I would know most, because just like you said, 80% of tuberculosis cases are pulmonary. And so many people just think it just has to do with the lungs. The person just has to cough. And so if the person is not coughing, you know, and people don't know how much at risk they are, you know, to getting tuberculosis. So are there risk factors that predispose people, you know, to contacting tuberculosis faster or easier?
Oh yeah, so again, we'll discuss that in 3 scenarios. Number one, I think we've talked already about coming down with the disease. So someone becomes, when the infection becomes active and begins to cause, you know, changes and destruction in the body tissue, so that becomes active TB, right? But then where someone is exposed, that's now a different thing. So exposure meaning you are in proximity with someone who has active TB of the lungs, and such an individual is coughing, and you're inhaling the droplet nuclei.
Directly. Good.
So conditions that will predispose to that will include generally first environmental, okay? So meaning you have overcrowding, for instance, and then poor living conditions, all right? Where you don't have ventilations, And by the way, you should have cross ventilations, okay, to ensure, your risk is reduced, okay? Good. So then, people obviously who are family members with active TB, and then where infection prevention control measures, have not been instituted. So these people, and should I mention active TB cases that have yet to start treatment? They are the most important, I should emphasize here, because we know it for a fact that as soon as someone starts treating for tuberculosis, within 2 to 4 weeks, 1 month, the person is no longer as infectious. Meaning, even though he or she might cough, but there's not so much of the organism, okay, in the droplets, okay, to infect other persons around him or her. So these will become the factors that will predispose someone to being exposed to getting the droplet and nuclei, which is the first thing actually that should happen before we begin to talk about someone coming down with the disease.
Okay. So this thing you said now brings us, the importance of prevention.
Yes.
So if you know that you have this risk factor, how do people go about preventing themselves from contracting tuberculosis?
Okay, so I want to begin first with any individual who is coughing for any reason. So if you're not sure that your cough, if you have yet to see a doctor to have a diagnosis, it's good you observe cough etiquette. So people who are coughing are taught to observe this etiquette to prevent the pathogen going out and spreading to other persons around them. And then you're told when you cough into the elbow or into a handkerchief, all right? So it's actually wrong to cough into the open air in a room or what have you. Good. So when you observe cough etiquette, then you have started prevention for us, all right? So what's left now will be for other persons close to this person who is coughing. So as an individual, you try, to have a well-ventilated ambience, wherever, be it at the office or at home. Ensure you have good ventilation between yourself and someone who is there and is coughing. All right, such that you don't have the air filled up with a lot of this organism, okay, to be spreading. So if you have air conditioners, fine, but you ensure that they are the ones designated to have filters that can filter out that pathogen, all right? We have such filters in some air conditioners. Okay, good. But then if you have fans, good, you direct it such that it cuts the air across between yourself and whoever is coughing, all right, within you and in the office. So that's why you see doctors, when they sit and they consult, they sit in a certain position where the patient is sitting across from them. And they ensure there is cross ventilation, okay, from one end to the other. And then you ensure your windows are wide open as well, all right? And then in the program, we actually we give you sort of a designation of how the windows should look like, but in a nutshell, they should be wide enough to allow for cross ventilation from one end of the room to the other. Okay, so you can institute this, but then where they also exist, you have other sterilization techniques like use of ultraviolet rays, but those are not readily available here. So, but the commonest will be ensure this cough etiquette in an individual who is coughing, ensure cross ventilation in your living areas, in your workspaces, ensure good general hygiene and sanitations, all right? So even for the individual who coughs into elbow or hanky and all of that, wash thoroughly and every time. But then if such an individual can get to the hospital as quickly as possible and get a diagnosis, it's best for everyone. Yeah, so these are some of the things you can do, but then not forgetting to ensure you have good nutrition as well. Okay, so you eat well and all of that, because when your immunity is good, you are protected. But again, also ensure you don't have underlying medical conditions, like we said. If an individual were to have HIV, for instance, it's important you routinely or frequently check yourself. Yeah, we do that for all of them, actually, to see that they are not having TB, because TB is the highest killer of persons with HIV if they don't, if they are not attended to properly.
So let's talk about some myths and misconceptions that people have about tuberculosis. You know, and I remember during COVID, people were even scared of going to the hospital because nobody wanted to be diagnosed with COVID. And we're having issues where even people with tuberculosis were not going to the hospital, you know, because they were even scared they were going to be diagnosed with COVID. And that year, I think the theme for TB, during the TB day, was check that cough, if it be tuberculosis,
yes,
you know.
Check our more.
Yes, check our more. And so people just have certain myths around, you know, to what they believe tuberculosis is, some misconceptions they have about. Some people feel it's a punishment from God. Some people feel it's, you know, especially, you know, when you spoke about, you know, the different parts of the body where tuberculosis could actually affect, and people do not know. So when they eventually are diagnosed with these things, somehow, sometimes they're not able to connect to how can tuberculosis affect my spine, you know, and people begin to think that, okay, maybe it's a punishment from God or it's something we've done, you know. Let's talk about some of these myths and misconceptions.
There is no end to the myths and the misconceptions that we have heard of around tuberculosis. They go from some of the relatively understandable to some of the very weirdest. So, but commonly, I would say a lot of time people attribute them to spirituality, and that is unfortunate. So, and because a lot of time, you know, so it's a chronic disease. So that's one that distinguishes it from uncompleted malarias. Malarias, you would have them running a course of a few weeks, I mean, from beginning of, you know, infestation of the parasite to manifestation of symptoms, right? And the person will be treated. But for TB, like we said, it could lodge in the body for years. From that latent infection, it could be 5-10 years. And then when it becomes active, someone might actually get sick for 2, 3, 4, 5 years before the person is actually able to get to where someone can diagnose him. So if a lot of time had passed between when the person actually started suffering the disease and when you're seeing him or her, he would very likely had lost a lot of weight. And we know how the society looks at people who have such kind of weight loss, all right? So despite, well, eating for some time and all of that, so they think, no, this is no longer, this is paranormal. This is no longer a hospital thing. This is no longer, because oftentimes they would have had all sorts of medications. You know how people self-medicate a lot around that environment. So, and then they will say, no, this is no longer a thing for the hospital. It must be something from the village. It must be something, you know. So they begin to consult, you know, shalamans and what have you. So at that point, you lose them because they are no longer within the purview of modern medicines. And then the unfortunate story is a lot of them actually die when they, because even the man who is treating them, the traditionalist, doesn't know any better. So they attribute it a lot. Is one of the biggest myths that this is a spiritual problem. The other is a lot of time they say it's poison. So people will say, no, somebody would have poisoned my food or poisoned my drink, you know, because of that weight loss. So they think, no, it's poison. So they begin to blame someone else, you know. A lot of time we have seen it in very, very young children, if I were to say that. People newly born, well, let me say in infancy. We've seen people in their first year of life having TB. Children, I mean, in their first year of life having children. But then, under 5 generally, you see TB in them. And then the parents will be thinking, no, this child is Ogbanje and things like that. That this child eats or suckles the breast milk but doesn't add weight. Yeah, it's not growing like the peers. So they begin to say, no, this is something about the gods. So again, they begin to label such kind of children different sort of things, all right? But then you find that in many cases, and we've seen numbers of them, when they get the necessary intervention, you see the baby getting cured of TB and then just thriving very well and doing very well. So lots of myths, you know, that's around it. Yes, the one about the COVID. So I would say COVID was, if you like, was a mix for us, a blessing and a curse. Okay, because COVID actually brought out the, if you like, for me, the importance to create awareness around tuberculosis. So now people realized, you know, there is this disease that actually has cough as its biggest symptom, but actually kills, okay? So when COVID came, a lot of people initially thought all cough would be COVID until the program. We started to tell people that, no, check Hamo if you have cough. It may not be COVID. And the truth is, yes, so we know for COVID we have the vaccine, but then we sort of just supportive treatment is what we do for COVID. But then for tuberculosis, we have the cure, and the cure is free. Okay, so I mean, if someone were to start coughing, let's think we are back or take ourselves back to 2020, and someone starts coughing and goes to the hospital, and others get diagnosed of COVID, and this particular individual gets diagnosed of tuberculosis. I believe that individual will feel luckier, right? To be diagnosed with tuberculosis.
Is even something to feel lucky
Oh,
about.
yeah, well, so again, that's why I say it's mixed feeling with COVID when COVID came. Okay, if you're comparing it with tuberculosis, because yes, with tuberculosis, we have the treatment. And again, like I said, the treatment is free. You have to just take your medicines for 6 months. You stay on it and you're totally cured of tuberculosis. So yes, there were lots of myths and misconceptions, and there still are myths and misconceptions. But then it's very easy to distinguish between COVID and tuberculosis. COVID, oftentimes it would have recent history, meaning the person may just start coughing, you know, in a few days or a week or so. But for tuberculosis, oftentimes they're not. The person would have been coughing for a lot longer, all right? Usually more than 2 weeks.
Okay, so I'd like us to take a short break because after this break, I want us to talk about testing, because, you know, this is a TB testing week and the importance of testing and getting all those people that we have missed and we've not been able to find, and why it is important that we need to find them and test them. But we're going to go on a very short break, and when we return, our discussion will continue. Do stay with us.
Hi everyone, here are some practical tips on what you should do to avoid breast cancer.
Examine your breast on your birthday of each month. For instance, if you're born on the 12th of May, examine your breast every 12th of each month. Get familiar with the shape, the sizes, and the textures of your breast and nipple. Don't forget to check your armpits for lumps.
Reduce the intake of fried foods. The oils used to fry many fried foods release chemicals that can be harmful to your body.
Eat lots of vegetables. This contains the nutrients that your body needs to help fight off diseases.
Tooth and gum diseases have been linked to cancer, memory loss, heart diseases, dementia, and stroke. Make sure you brush at least twice a day, especially before you go to bed. If you can, floss regularly and have your teeth checked at least once every year.
Reduce your exposure to toxins by minimizing your use of hairsprays and deodorants containing aluminum and leads as much as possible.
Avoid smoking.
Exercise regularly, at least 3 times a week.
If you have babies, make sure you breastfeed exclusively for at least 6 months.
As women, you should avoid placing your smartphone in your breast pocket or inside your bra. Some believe that this will emit high levels of radiation which could lead to breast cancer and other forms of cancer. Secondly, you should avoid or limit your intake of highly processed foods, aka junk foods, as they contain toxins that are harmful to the body.
Welcome back, and thank you for staying with us. If you're just joining us, this is Health and Wellbeing, and I've been here with Dr. Michael Alion. We'll be talking about tuberculosis and all you need to know. If you're just joining us, you've missed, but there's still more for you. So before we went on the break, I said we're going to talk about testing and why it is important that we test. So let's start from, is this testing for everybody that feels he or she wants to get tested, or is testing just for people that are showing symptoms?
Oh, thank you very much for that question. So I would say yes. Everyone and anyone can go and get tested for TB. So in the beginning of this conversation, we've talked about 2 categories of persons.
Yes.
Those that would have active TB and those who may have latent TB. So those with latent TB infection would have no symptoms whatsoever. to begin to suspect that something is lodged in their lungs and waiting. So it's especially important for this category of persons. Remember, we say prevention is better than cure, is it not?
Yeah.
So it's important that you come out as an individual and then ask, okay, I want to get tested to see if I have latent TB infection. Good. And then if you actually are able to get that done and then you realize you have latent TB, it's simple. You take the treatment and it clears off that TB that's lying dormant and just waiting for the D-Day to rear its head.
Yes.
Isn't that safer?
Safer.
You would agree it's safer. And then you'll understand that there are countries you want to visit today and they would request, their embassies as part of the visa requirements, that you would furnish them a TB test result. Okay, good. So they are trying to protect the health of their citizenry. They don't want you importing the TB. They know you might be looking well, but you may be harboring the latent infection.
Yes.
So that's why they're doing these things. So, but again, I have to draw a distinction between the test that is done for latent TB and that done for people with active TB.
Yeah.
So remember, the person with latent TB is not coughing, right? So he's not bringing out sputum. All right. So usually we do assays. We either take blood or we can do skin tests. Depending on whichever your healthcare provider has, he will be able to test and tell whether you have latent TB infection, which is different from an individual who has the active disease and is coughing, because when this individual is coughing, he or she will bring out sputum.
Yeah.
And it's that sputum that we'll be taking in a container and we'll take to molecular test to be able to tell if it contains the Mycobacterium tuberculosis complex. Okay, so that's how we diagnose it in active TB cases. Okay, vis-a-vis the latent TB infection. But then there are other group, okay, that we have to say a thing or two about. So about children, very young children,
Yes.
below the age of 5. They are unable to cough and expectorate. I mean, they can't bring up sputum like adults would. So rather, they would cough and then swallow the sputum. So this sputum will go through their intestines, and then we ask the parents to get some of that too when they pass it, okay? And then we subject it equally to the same testing like we do for the sputum. And we are able to test and tell whether such a child has TB just from the stool. So I'm saying this in case a healthcare provider has asked a mother or a father to bring stool of the child. Because we get kickbacks, you know, in some cases where the parents will be objecting and asking why you're asking to get this stool of a child. In fact, we've heard another myth, remind me of another myth. Elsewhere, some people say they want to take the stool of the children for rituals. So you can see how these things can affect the program. So I'm just trying to pass this message out there that yes, you might be requested where it's the case of a child to bring the stool of such a child for testing. Okay, so these are the different tests that are available. But then I'm thinking again, it might be necessary to say a thing or two about the extrapulmonary TB.
Yeah.
Okay. So where you have the TB outside the lungs, the truth again is that, yes, we can test wherever the TB might be. So it depends on the tissue that is infected. So if we were to speak of the TB meningitis, for instance, where the organism is infecting the brain, so we can do a spinal tap where we get the CSF, the cerebrospinal fluid, and then we send that fluid also for the same testing. So we can also tell if the organism is there. So once we can isolate the organism from such a specimen, it's clear that that is what is causing the disease in such an individual. In other parts of the body, we may want to do biopsies. Okay, so you may want to biopsy the kidney, for instance. Okay, so biopsy would mean taking a pinch, a small part of that organ or tissue, and subjecting it, to histology, all right, to be able to tell what's the form of the changes that's happening in that tissue. Is it in keeping with what TB does, or can you just actually isolate the organism in such tissue? All right, so you could do a biopsy, but very importantly too, we have what we refer to as lymph nodes around the body, which are small if you like, no more than peanuts, but around our bodies, and you only get to be aware of their presence when you have cut your feet, for instance, and then you see them swelling. So these glands get swollen oftentimes when they are challenged by foreign organisms entering the body. Yeah, so you find them very often in children. You find them somewhere around the apex, is close to the neck here, getting really enlarged and swollen. And clinicians find it easy to suspect these lymph node swellings, and then they begin to diagnose for TB. Okay, so like we said, it could vary from one part of the body to the other, but whichever part of the body it might be, you know, lodged in, we always find a way to get a clinical specimen and test for TB.
Okay, so for the program, anybody can actually access testing, right? And I'd also like, for most especially for audience, where can they access testing? And is testing for tuberculosis free? Because I heard you say treatment is free, but is testing free?
Oh, so a good one. I again always like to say that testing is free. I'll never get tired of saying that. And I want to add again, like you've asked, that testing is also free. So all services around diagnosing and treating tuberculosis in Nigeria as it stands today, all the services are actually free. Yes. But I would like to make a caveat, being that some people may get to make some payments at some point, and that's only if from the onset it wasn't clear that what the individual had was tuberculosis. So if someone were to have fever and coughing and you go to a hospital, TB is not written on the face, right?
And it's not the first
So
thing that
obviously
will
you're
come
going
to
to go
mind.
through the same route as everyone else.
Yes.
You have to pay for card, pay for consultation, pay for all those, the testings. So those preliminary procedures, okay, till the point where you get diagnosed, you may have to pay for them. All right, good. So, but compare that to an individual who has heard this message and is able to get to one of our focal points, be it a hospital that is designated to provide TB services, or a trained clinician, health care worker who provides TB services. If he or she walks directly to that center and says, oh, I think I might just have tuberculosis, and that center takes him or her from that point onwards and diagnose, the individual will not have to pay a penny all through till treatment, testing, follow-up, everything will be free from beginning till the end. So that's the good news about it. So that's why it's important, again, we pass the message out there, that if people are coughing for longer than 2 weeks, we would advise you just check our mo. So we have a toll-free number, actually, 3340. You can dial it, and you won't be charged, and then somebody will be on the other end to provide you all the support you need. Point you to the closest center to you that will provide you that service, because we have a network of centers across the country, health facilities that have these services in spectrum. So in case you're not aware where the closest dot site might be to you, you could call the number 3340. And by dot site, I actually mean directly observed treatment short course. So that's the term we use for every hospital that we have our services provided at, where you can get your sputum collected for testing, and if it's positive, you can start your treatment. The medicines will be there provided for you and all of that.
Okay, because I was going to ask where can people access, but 3340 is the number, right?
Yes.
3340 is the number to call if you're wondering how can I get tested, and it's free if you call. The number is free, actually, 3340, and then you'll be able to get to the nearest TB center close to you. So let's talk about treatment. You know, treatment is free. Why is it important? One of the things I hear people talk about, or even medical personnel talk about very much, is you have to go through your medications from beginning to end. And it's a very terrible attitude for us at this part of the world. We don't take our medications completely. Why is it important that people that are undergoing TB treatment make sure that they complete their doses?
Oh, thank you. That's a wonderful question. I must say you'll be saving millions of lives, you know, by asking this question. Because there are, we've talked about TB in different parts of the body, right?
Yes.
But there's also two forms of TB with respect to discussion around resistance profile. And in this case, we mean resistant TB and drug-susceptible TB. So drug-susceptible TB oftentimes is what you find in most cases, all right? Good. And usually people who call for the first time and have not had TB before oftentimes present with drug-susceptible TB. And that's a form of TB that's, amenable to our treatment regimens. Okay, so we have the medicines, a cocktail of them, 4 of them majorly. And then we combine them because the organism, you could call it a stubborn one, grows very slowly, divides every 60 hours as against other bacteria that divide almost every 4 hours or so. So you also have to sustain the treatment for a very long time to be able to have those dividing phases of the bacterium, targeted. So the individual is to stay on the treatment for currently a minimum of 6 months for drug-susceptible TB.
Yes.
Good. And you take your pills daily for that 6-month course. Now, it used to be longer. Back in the day, it used to be 18 months or more. In fact, a lot of that. But you see, research and innovations is bringing it down. In fact, we're looking towards even shortening that in the near future. But at this point, 6 months, and you stay daily on your medicines. And why we call the program Directly Observed Treatment Short Course, DOT for short, is that someone has to directly observe you taking the pills on a daily basis to ensure you don't miss any dose. Okay? Well, missed doses may happen, but where that happens, we find ways to. But the ideal is that an individual on treatment should not miss dose at all for the 6-month period. Because if you do that, we can beat our chest that 100% of the time, the individual will be cured. So now, why we advise that you do this and not miss your doses, or take for 1 week and because you're feeling better. Remember I told you in the beginning that if an individual stays on the treatment for 2 weeks or 4 weeks, he will feel better.
Yes.
Okay, and it may not even infect other people. Because at that point, 1 month after commencing treatment, the drug already has done some good reduction of the load of the organism in the individual's body. Good. But notwithstanding, you would still have some of it left. So if you think that after 1 month of taking these medicines, you think now you're okay and you disobey your doctor's prescription and stop using the medicine, that residue of the organism that's left in you would now learn ways to resist the treatment. So now you have the other form of TB that I mentioned at the beginning, which is drug-resistant tuberculosis. And it's a lot more difficult form of it to treat. So you don't want to go through it because the treatment is longer. In fact, back in the day, it had to be by injectables. You have to inject the person almost on a daily basis for more than 18 months. So it's not an easy one. But again, with innovations, we've been able to reduce the duration for treating drug-resistant TB to about 9 months to 11 months as it stands today. But then you see that it's even longer, all right, compared to the drug-susceptible TB. And it takes a lot more effort to treat than you would do with drug-susceptible TB. So we actually encourage people to complete their medicines for 6 months or for as long as the doctor would have prescribed it.
Yes, okay. So just before we wrap up on the program, I'd just like you to give us some success stories. You've been on the program for a while now. Success stories of people, that came under the program and have been treated and are most likely ambassadors now for the cause. Okay, so I'm trying to think of some, but that of a particular baby just keeps coming to mind. So this baby was about 8 months or so, and then the baby was abandoned by the parents because the baby was looking really skinny, very skinny, and then was very sickly. Despite all treatment giving, the child would not improve. So they actually abandoned the baby, but somehow I think a faith-based organization
intervened and then took care of the baby, and then were able to take the child for a medical review, and then eventually TB was diagnosed in this baby. And then as soon as they commenced treatment, you could see the obvious improvements.
Yeah.
All right, the baby got back to health and then flourished, okay, such that you could see a very beautiful child. And then the parents came back and then accepted the baby again.
Yeah.
Yes, it's one of those stories that we are hoping to put out soon. I mean, when that, because this is fresh in my mind, that's why I just couldn't but, mention it. It's not even out there yet. It's just one of these recent meetings I just came back from that story was brought to us, and it was really it was touching. Yes. So there are many such stories, okay? Well, for sake of time, maybe in another conversation, I'll bring up more.
Even the baby story.
Yes, I'll bring up more prominent. Probably be able to tell you of more prominent persons that have benefited from TB.
Well, thank you very much, Dr. Ali, for taking our time to be with us on the program. But I'd just like you to give your word of advice, to the public out there concerning TB testing, TB treatment, and how they should take care of themselves.
All right, so we are about to mark the TB testing week. In fact, starting from now, you can come out, just take a minute or two and ask the question. In fact, from the comfort of your home or office, you can just dial the number 3340 and someone will be on the other end to respond. And then you can just simply ask, where can I check myself for tuberculosis? It's as simple as that. And then you just follow, the advice. So obviously the other person will ask if you're coughing and all of that. You just respond as sincerely as you can, and they will be able to guide you to go test yourself for if they think you have active TB or latent TB infection. In any case, it will be a stitch in time that saves 9.
Thank you very much. Thank you very much, Dr. Ali. We sincerely appreciate your presence on the program today.
Thank you, Lois.
Thank you so much.
Thank you for
that's
having me.
how far we can take on the program today. Remember, TB Testing Week serves as a reminder to prioritize our health. Whether you're getting tested or you're spreading awareness, you are contributing to a healthier world. So stay informed, stay safe, and together we can tackle TB. Keep it to date with us same time next week. I am Lois Apasambo. Do stay safe.